Surgeons, just like any other group of professionals, sometimes get carried along by waves of enthusiasm for the new thing. And it's very difficult to resist that. When we have a new technique or a new technology in surgery, big pressures build up quite quickly to get this into practice as soon as possible. And unfortunately, we can sometimes get ahead of ourselves and start using things widely before we've proved that they're any better, or before we've carefully looked to identify all the risks. And there are numerous examples of that if you go back years and decades in surgery, where we could have avoided a lot of unnecessary harm and problems by evaluating things more carefully as we went along. And that's really the main message I had, that we have to try and do better. But how can we do better? Because the enthusiasm of surgeons is now backed by very powerful commercial influences. People who've invested a lot of money in new technology for surgery want to see that used and want to make a profit out of it. So we have to look at how we can make sure that all surgical techniques are properly and safely evaluated. And I think we need two things for that. One is a standardized system for doing studies on each new technique and doing them step by step. So there are certain things you should do right at the start, for instance, to make sure that the thing has been fully developed, that it's not going to be changed again before you start using it. Another, to make sure that all the surgeons have learned how to use it, because you wouldn't want surgeons who hadn't learned doing it to you. But the other thing is actually that it may be necessary for governments or regulatory bodies to impose this on us, because we've seen from the past that it's very difficult, with the best will in the world, to get good trials done when everybody's terribly enthusiastic. So I guess I was calling for those two things, for a kind of standardized system and for a rule book that everybody has to follow. And I think in the end that's going to end up being beneficial to patients in a lot of ways. It'll be safer, of course. It'll give us better evidence that what we're doing is the right thing. But I think it'll also be cheaper and faster in the long run than the kind of way we do it at the moment, which is to rush forward and then take 3 steps back.